Imagine having a plate of food in front of you and not being able to eat it because you are convinced that the plate has poison in it that will kill you. Hallucinations, delusions, disorganized thinking, feeling alone and scared of the voices inside of your own head. These are the very real and terrifying symptoms that people with a schizophrenic disorder must face all the time. Schizophrenia is a mental illness that attacks the five senses. People exhibit the effects in different ways. For some, it comes on as visual hallucinations, while for others, the illness comes in the form of paranoid delusions. This illness is characterized by a disconnection from reality, and it affects 1% of the population of the United States, which is around 3 million people. Why did I choose to talk about this topic? I've always been interested in abnormal psychology, and while I do not have any close friends or family that have this illness, I do interact with a patient that has paranoid schizophrenia on a weekly basis. These interactions can be anywhere from pleasant to terrifying. I want to shed light on this illness that is so easily overlooked. Schizophrenia can be a detrimental disease if not managed correctly. Those that do not have proper access to treatment can suffer greatly. More light should be shown on this taboo disease that can sometimes rob people of their sanity as well as their ability to integrate in society. Today, I want to discuss what symptoms manifest themselves in schizophrenia. After understanding more about the actions of those affected, I will be discussing the causes of this illness. The type of treatment available to patients with schizophrenia will close out the speech. As I stated previously, schizophrenia can manifest itself in many ways. There is the type that causes delusions, which is a type of schizophrenia in which individuals are not oriented to reality and they believe in false ideas. This type can lead to paranoid schizophrenia, which is the idea that everybody is out to get you. Unfortunately, the patient with paranoid schizophrenia has a tendency to get violent. Hallucinations, which is seeing, hearing, or feeling things that aren't really there, is another form of schizophrenia. This sometimes comes in the form of hearing voices or seeing imaginary elephants in the room morphing in different colors. Disorganized behavior is something that people with schizophrenia often exhibit. They don't know how to make sense of anything because they're being pulled in so many different directions sometimes. They will act out of confusion. This includes unprovoked outbursts, impulsive actions, or simply the lack of personal hygiene. Their everyday routines come out of whack. The person with schizophrenia may exhibit lack of wanting to interact in social settings, depression, or emotional flatness. So genetics is another reason why people have schizophrenia. Patients with one parent that have schizophrenia have a 13% chance of developing the illness. If both their parents have schizophrenia, there is a 39% chance that the offspring will develop the schizophrenia later in life. There is an even greater chance if the mother had the flu while pregnant. A person's chemistry is another cause of schizophrenia. If there is an imbalance in the neurotransmitters serotonin, dopamine, or glutamate, there is a chance of developing this mental illness. The imbalance will affect a person's response to stimuli in the outside environments. And substance abuse. It is believed that if a young person takes psychoactive drugs, it may manifest the symptoms of schizophrenia, especially if you are predisposed due to genetics. While there is no cure for schizophrenia, there are ways of managing the symptoms for those that have access. So there are antipsychotic medications. These help reduce the biochemical imbalances presented in schizophrenia. Haldol is an example of a commonly used medicine. There's also therapy, different types of therapy. Having a strong support group and people that care for you are important in managing this illness. There are housing programs that are 24-hour support and supervision. The patients live in these facilities and they're cared for. And there's individual and group therapies that help the patient feel connected and creates a safe environment to voice concerns while orientating back to reality. The patient with schizophrenia may lose sight of who they are, the once vibrant person that becomes a shell to the host of the disease. While it is a confusing and often frustrating time for the patient and those close to them, it can be managed through therapy and medications. Unfortunately, treatment can be expensive, and oftentimes mental illness is seen as taboo, so people feel embarrassed to seek help. People may lose employment or support from family and often become homeless. If there are no means to receive treatment, the illness can be a vicious cycle of sorrow. Thank you for listening, and I hope you have learned a little something about this disease.